just did call me and tell me she was not going to be here. She's got a new radio gig that she's doing. She may be here later. Any public comment?
No public comment.
Okay, moving on to chairman's report. I have no remarks. I'll entertain a motion to approve the minutes of Tuesday, August 18th.
So moved.
A motion by member DeCiani, a second by member Larson. Roll call, please. Are any additions, corrections, or deletions? There being none, roll call.
Member DeCiani?
Aye.
Member Eckloff?
Aye.
Member Larson?
Aye.
Member Renahan?
Aye.
Member Dessert? And Chair DeTornatore.
Aye, and the minutes are approved. Move on to length of service award, 10 years for our French Polly Chivetti. We all know her. We all care for her. She is a bright ray of sunshine to all of us, and I will stop there and turn it over to Mary.
I'll just
Let
start
you
by
keep
saying,
going ahead.
I'll say ditto.
Oh, there you go. She deserves more than that.
Right.
So go ahead.
Yeah. Shefali is an absolutely tireless worker on behalf of Giving DuPage and the county overall. Her dedication to the work that she does is absolutely exemplary. Her passion for the mission of the organization, how deeply she believes in helping the nonprofits, help the people that we serve, is really inspirational. She's really she's just an incredible person. I'm gonna make her cry, I can see.
You are. You really are.
Really, she's just, like I said, she's just an absolute tireless advocate for the nonprofit community, for the folks that they serve, and she's just a pleasure to be around. She's kind of tiring to be around sometimes because she's got so much energy. That no, it's such a pleasure to work with Shefali. Such a pleasure to just see how deeply she cares about the work that she does. Member Larson might want to say a few words because he was on the Giving DuPage board.
Sure, I'd be happy to. Shefali and I worked together for 6 years on the Giving DuPage board, and boy, does she emphasize the word giving. Just there are times, and she does get emotional in part because she cares so deeply and works so hard at it. She would always take us to task as a board, calling for us to do more. But she would work nights, weekends, well beyond what she's paid to do. She's a true believer in giving to other people and lives that example. And I wish we had 1,000 more of her around here.
I think it's your turn to say something, Shefali.
Well, I'll keep it brief because I know you guys have a big agenda. If somebody told me that I was going to be working at the county for 10 years, I would have never believed it. I didn't know, but it really is a testament to the work. Yes, I'm incredibly proud of my work with Giving DuPage, but I also started under environmental initiatives at the county. So you guys did make me cry. Good job. I'm a little choked up. I'm a little verklempt, but it really is. I've been lucky to do work that I really enjoy and work for people that I really respect and regard highly. So thank you.
You're welcome.
Can I just tell one story? I think that I'd like to tell a story of how Shefali came to be the executive director of Giving DuPage. I was chatting with Shefali. Shefali was working for in the environmental division, and we were at a fundraiser. I didn't know she was going to be there. She probably didn't know I was going to be there. And we started chatting, and the previous executive director of Giving DuPage had just left. And we just started talking, and I heard more about her background. You may or may not know that Shefali used to work for the Greater Chicago Food Depository. So her, I didn't know at that time that she had a background in nonprofit management. She was so passionate about, not just environmental causes, but nonprofit causes. And like I said, the timing was perfect. We chatted. I was like, oh, you really should apply for this job because you. So, but that's how she came from. She started in environmental, and that's how she ended up with Giving DuPage. And couldn't be happier that she made the move over to our department. So, thanks, Shefali.
Thank you, guys.
Environmental's loss was our gain on that. And Shefali, thank you so much. Hopefully you'll be here at least another 10, and then we'll celebrate that and just keep moving on. So
Sounds good. Sounds good. See you guys. Have a good one. Bye.
Okay, Okay, moving on to item number 7, community service. I'll entertain a motion to combine and approve items 7, A, B, C, and D. These are acceptance, appropriations, and issuance of payments to grants, some of which are CARES grants as well.
So moved. Second.
Motion is second. Any discussion? Questions, comments? Roll call, please.
Member Larson.
Aye.
Member Ranahan.
Aye.
Member Desart. Member DeCiani.
Aye.
Member Eckhoff.
Aye.
Chair Tornatori.
Aye, and the motion carries. Moving on to budget transfers, I'll entertain a motion to approve the budget transfer to DuPage Care Center to transfer monies to cover the sharp box containers disposal and interpreter services.
So moved. Second.
A motion and a second. Any questions, comments? Roll call, please.
Member Larson.
Aye.
Member Ranahan.
Aye.
Member Desart. Member DeCiani.
Aye.
Member Eckhoff.
Aye.
And Chair Tornatori.
Aye, and the motion carries. Moving on to informational, I'll entertain a motion to receive and place on file grant proposal notifications, A and B, to CARES Act grant for the Northern Illinois Area Agency on Aging, as well as the second allocation to the U.S. Department of Housing and Urban Development.
So moved.
Second.
The motion and a second. Any questions, comments, discussion? There being none, roll call, please.
Member Larson.
Aye.
Member Ranahan.
Aye.
Member Desart. Member DeCiani.
Aye.
Member Eckhoff.
Aye.
Chair Tornatori.
Aye, and the motion carries. Do we have any residency waivers this morning?
No residency waivers.
Okay, community services, Mary.
Put together a great report on Giving Page and some of the activities. One of the things that came up in my budget presentation was how much of the funding comes from the county. Roughly 60% of the operating budget for Giving Page is privately raised. So it comes from either registrations for events or sponsorships. But I'll circulate a wealth of information to this committee after this meeting today. Just wanted to give you an update on some of the other things that we're working on. Our biggest task right now in the department is we're working through all the applications for the Coronavirus Relief Fund. We will be bringing hopefully to, well, for sure, these the agreements for the residential and behavioral health services, as well as the direct cost reimbursements for IT and PPE and social distance measures. Those will be coming to finance and the board next week. For behavioral behavioral health and residential service providers, there are 10 agencies approved for about $825,000. For the direct cost reimbursements, we're looking at 43 agencies receiving about $1.5 million. I'm also in the process of working through the program design and grant agreements for the Northern Illinois Food Bank for their allocation, as well as the 3 largest food pantries, People's Resource Center, West Suburban Community Pantry, and Loaves and Fishes. Those 4 agencies combined will be getting $1 million in assistance. One of the things that both the Northern Illinois Food Bank and those 3 food pantries asked was whether they could use some of the funds for equipment. A number of the pantries have increased, everybody's got increased demand, but that has also raised the need for cold storage, so additional refrigeration and freezer space, particularly so that they can properly store dairy and protein. So my thought is probably about somewhere between 12 and 15% of the funds we will allow them to use for equipment, as long as that's okay with the board. I'm also working with Member Larson and the Health Department and the DuPage Health Coalition on the program design and agreements for the flu vaccination program for uninsured residents. Hopefully we may get those agreements again to finance and the board next week. I think that's our goal. Finally, just an FYI, calls to our information and referral unit are up 20% from this time last year. Some of that is attributable to the fact that MyHeap applications opened early this year, so we're currently scheduling MyHeap appointments. But I do still anticipate that that high call volume will continue probably for the foreseeable future. I think that's all the updates I have.
Okay, thank you. Any questions of Mary?
I have
Oh.
a question. Any better, I can't even think of what I'm trying to say, more staff people to help service those calls? Are you making headway in that respect? 'Cause I know you were understaffed at.
Yeah, our information referral unit has been down staff all year. Those tend to be very difficult positions to fill and keep. So we are currently down staff. We're working on it, but
Yeah, I'm sure you are. Thank you.
Vice Chairman Ryan.
Thanks. Just quick question. Thanks, Mary, for the update. I think you said 825,000 for behavioral services. I thought we had allocated $1 million. What am I missing here?
you're missing that they didn't apply for $1 million. Basically, so what agencies were required to do was submit, so for residential and behavioral health providers, they were, the application process was that they had to submit their actual expenses from March through the end of June for any additional staff hours, and then a projection of what they would need to get them through the end of December. So they submitted for things like additional counseling services, additional IT equipment. So the total amount, I believe we're approving every single request that we received. So the total amount was 825. There's nothing that says that we can't reach back out after we get these through, maybe do a second round of applications. I think agencies were trying to be realistic about their capacity to spend this money by the end of December. And also, they're looking at the real, sort of the real expense. So if they bring on one full-time counselor, here's how much it's going to cost, knowing that they only have that funding till the end of December. But there's nothing that says we can't reach back out and ask if they can, but it, we're paying for staffing. So it's 6 months of additional staffing.
Okay, I just want to make sure if we could push it out. I know that our coroner had said we're up 52% on overdoses and suicides during, from last year due to this COVID situation. So I just want to make sure all those dollars get used up.
Right, absolutely. And one of the things in terms of increasing long-term capacity beyond December, one of the applications we received was for the DuPage Health Coalition to do additional training and certification for physicians to become certified in medication-assisted treatment. So once once they have that training, then they can do medication-assisted treatment for the long term, and that really increases the system capacity past the spending deadline for the coronavirus relief fund.
Yeah, I saw that. Thank you.
Any other questions, Mary? Thank you, Mary. Move on to the DuPage Care Center update. Janelle, I see you're on.
Yes, can everyone hear me okay?
Yes.
I'm certainly going to give an update on all things COVID for the care center. So we currently have 3 residents on our COVID unit. One has been there quite some time, actually tested positive over 7 weeks ago, was not expected to make it and rallied and has been back with us for a couple weeks now. Interestingly enough, we still get positive and negative test results from this individual after that many weeks. So definitely a interesting virus. So learning new things all the time. Since April, we've had 35 staff members test positive and 30 residents. We've conducted over 7,000 tests in-house. CMS came out with a phased reopening approach. It's 3 phases. And if you have a positive result, you would revert back to the highest level of mitigation or back to phase 1. It's a very convoluted and complex and challenging process to make it through the phases. We had gone over 14 days without a positive result, but then we had a resident test positive, and so then we reverted back to phase 1. So you keep in mind our residents have been in their rooms, predominantly in their rooms for months. We have got to the point where we're able to do some outside activities in addition to outside visits, very structured outside visits with families. And this sort of positive result happens and reverts everything backwards. So very disappointing when residents had scheduled visits and then those had to be canceled. We're seeing far fewer cases, but 1 every 14 days doesn't help us much either. So we've had now 4 IDPH infection control surveys. I've questioned many times as to why, because most facilities in the area have only had 1 to 2. We feel as though they're coming here because we have so many beds that they're getting more bang for their bucks, so to speak. The surveys have gone very well. The last survey was a challenge. One of the surveyors that was here a couple of years ago. We had an issue with that surveyor and actually called in a complaint on that surveyor, which obviously then they do an investigation and the surveyor knows that. So when the surveyor came back in for this survey, she was very challenging, very demeaning, and was actually yelling at my director of nursing. So I then called in another concern to our local regional IDPH office. So I think that there's possibly some resolution from the fact that maybe we won't see the surveyor again for a while, but nonetheless, it was a very adversarial, upsetting survey. Everything has been resolved with that survey. But keep in mind now they're attaching fines and penalties with anything that they find, even the lowest level of deficiency. So we had a very minor issue that was identified and that was resolved within 3 days. So again, truly feel it was a result, and according to the staff, they were so scared and petrified that they probably could have told you their own names at times. So antigen testing, we received a government issued antigen testing machine. We had also purchased one from Medline. We're reviewing what that all entails. We certainly cannot do our volume of tests because keep in mind we're doing over 600 tests a week. But it certainly would help us if we have someone that's showing symptoms that we could test them and get a 15-minute turnaround. So we're going through all that material. Again, you have high-low control solutions, you have calibration cartridges. It's all under our current CLIA waiver. So it's pretty complex testing. We're making sure that we have all the right people educated on how to conduct those. So that's my report. Any questions for me?
Thanks, Janelle, for all the amazing work you do over there. A few questions for you. First of all, we haven't actually lost anybody to COVID-19 since the pandemic began, true?
We had 2 individuals that passed away in May. That would have been sent out to you via email letter, I believe.
Okay, and were they clearly documented? I know there's some controversy as to whether somebody who's at that stage of health, whether it's actually the cause
Right.
of death is COVID or not.
Correct. And we had, good point. We had actually 4 that were diagnosed with COVID that passed away with that diagnosis. 2, the medical director and the physicians caring for the individual said that was not the cause of death. So they are being they are scrutinizing all of the diagnoses and how the resident's presenting. So on record, we have 2.
Sorry, do we have any sense as to the false positivity rate on the COVID tests that are being administered?
You know, we really, when we get these, it's like we'll have a resident at the end of a hall and nobody else. And just this most recent one, we upped the testing. We did it like 3 days apart and still no other residents and no other staff. We just can't figure it out.
Yeah.
It's very unusual.
And then one other question, obviously we've got an election coming up. Do you have a plan in place for assisting the residents there who want to participate and vote as to how that's going to be addressed?
It's pretty much done through rec therapy does that. And so they're already still doing one-on-ones and small group, you know, where residents are in their doorways type programming. So that would continue under that current model anyway.
So when you say one-on-one,
I don't foresee that really changing the way that we do it because obviously we don't do voting or ballots in a group setting. So
right, okay.
That would
So somebody
still
just helps
continue.
them go through, once they receive a ballot, somebody helps them go.
Yes, that would be the normal process every year. Yep.
Okay, thank you.
I'll volunteer. Go over and help them go through their ballot.
I would. I
Any,
mean, let me in.
Member Eckhoff?
I know at the beginning of COVID-19, there was, I think we gave a raise to the healthcare providers over at the convalescent center. Did that cut down on them going back and forth between two different jobs at all?
That the incentive or the hazard pay that we've been providing has been very key in our success in containment. We have, at the beginning, staff were very reluctant, and now that we've went a few days or even a week without anybody on the unit with a positive COVID, they were wanting to work that unit, and where's that, that $5 an hour hazard pay. So it has been extremely helpful in our ability to staff and to care for this and to contain this virus to the extent that we have.
But I mean, do we have healthcare workers who are working, 30, 35 hours at the convalescent center and then going in and working at another healthcare facility for 20 hours a week just to increase their income?
Well, if they're part-time somewhere else, they have an obligation of certain number of hours or days that they have to meet with that other entity, just as we would. So I would say if they're going to pick up overtime or bonus or hazard pay hours, that certainly would be the incentive for them to pick them up at our building versus their other building.
Because my concern, and it's Monday morning quarterbacking, but if we could increase the pay of people who work in the convalescent center so they didn't have to do that and didn't go to another facility where they might be exposed to COVID-19 and bring it back to us, it seems like that would be a way to cut down the risk. And I didn't know if there's any.
I feel we have achieved that, Member Eckhoff. I feel that has been effective. Are you talking about a permanent increase in wages?
Well, at least during the pandemic, it would be nice if they only came and went from our facility and
Right.
didn't risk exposure at another facility and bringing it back. And, that's something that, you think about in September,
so-
that maybe we should have done in March, but I don't
We
know
were,
if going forward it's going to happen.
yeah, so we had a two-pronged approach. One was obviously the financial side. The other is anyone that worked in another building. So when they come into work, they have to write down where else they work. And if there's cases in those buildings, they're wearing, very early on, we put them in N95s and full PPE, even if they were working on a non-isolation unit. So we have protections in place from the very beginning to mitigate that risk.
I understand that the equipment or some other procedure might ameliorate the risk, but going forward, long-term, would it maybe it'd be an initial cost up front to pay somebody more, but long-term, maybe it'd be a reduction in the cost by increasing their pay, and that provided that they don't go work at another facility so that they decrease the risk. I just thought it's something to think about.
No, I would love it if they would all just work here, but in the industry, most employees keep their eggs in multiple baskets. It's just the nature of the industry, but I don't disagree. It'd be great if we were their primary and ultimately their only.
Thank you.
Thank you.
Any other questions of Janelle? Janelle, is it generally the policy of IDPH to send a surveyor back to us to conduct a survey after there's been a complaint made against them?
Yes. Unless it was a significant issue, but yes. It was just very frustrating. Just inappropriate behavior. Only so much I can say at this point, but the caliber of the surveyors is one thing, but when you add infection control, you're coming in to do an infection control survey. And if the surveyors themselves do not seem to be following infection control practices, and we're basically saying, no, you can't wear your own equipment in here. No, you can't take that home because you like what we've provided you. It's pretty disconcerting that you're here to judge us on infection control when you have your own issues. I've had to offer almost every survey, offer them hand sanitizer because they keep touching their mask.
Okay,
So-
well, that's
But you have to be
reassuring.
careful. It is, but you also have to be careful because, they have a high ability to retaliate. So we have to be very careful.
Okay, thank you very much, Janelle. Thanks for the
Thank
good
you.
work. Keep it up.
Thank you.
Any old business for the committee? Yes, Member Selman.
Thank you, Chairman Tornatori. Just briefly, I know there were some questions about giving DuPage last week. I just wanted to make myself and Member Hart available. He was stuck on a work call, but he did intend to be here. I know Mary said she's going to send out some further information, but if you have any questions, especially about the fantastic work Shefali did to get us volunteers for our COVID testing center and all the work she did in early spring to sort of help us keep afloat while we were trying to figure out a response to this crisis. I'm sure Greg and I both have some information we can provide you. So feel free to contact either of us if you have any further questions. Thank you, Chairman.
Great, thank you. Thanks for all your help, your volunteerism. Anything else under old business? Any new business? Okay, I'll entertain a motion to adjourn.
So second.
A motion and a second. Roll call.
Member Larson.
Aye.
Member Renahan.
Aye.
Member Dessert. Member DeCiani.
Aye.
Member Eckhoff.
Aye.
And Chair Tornatori.
Aye, and we are adjourned. And before I forget, thank you for joining us, Member.
Oh, thank you.
All members.